So, welcome to my class. I'm Professor Bogart. I am the lead pediatric professor. So, I'm that person you go to after your professor. If they can't answer questions, I'm always here for whoever. You can always send me messages. If you need anything, any extra information that I have or I can help you with, please just ask me. I will be sending it to you. Today we're going to be doing school age and adolescence. Now, this week there is no quiz. And the reason was, I said it earlier, but not everybody was here, is that Monday was Martin Luther King. 5 classes in peds are on Monday, which is almost half of the classes. So we don't give one quiz one week, other week. We do everything the same week. So next week with your exam, my classes most of you have asked to do it before the exam. Get the quiz done so you don't get it all mishmashed in your head. But that's up to you. Next week we'll talk about it. Do you want it before or after? I'm open to either way. So we'll discuss that next week with my class. Professor Pace Jasmar, you can discuss it with her. I'm sure she's just as open as I am, okay? So this week, as we were talking about, there is no discussion question. There's something with the dates. I'm going to go back and check them. If there's wrong with the dates, I'm going to fix them for you, okay?
Quick question.
Sure.
So I was looking in the where we in the modules, and it doesn't say when is our next exam or when is the quiz time. Can you put those there, or is a particular reason that are missing out that they're not there?
Okay. When you go to the syllabus,
Uh
you're going
huh.
to see every week, every exam. Now, our exams are on week 4, 7, and 10. The only day that you won't have a quiz on, well, this week was because of Martin Luther, but it's usually week 9 that there is no quiz, but usually it's either an exam or a quiz up to that point. Okay. When you get every week, I send out an information. It will say week 2, week 3 information. And I know Professor Goofs and Professor Pace Jasmar and all of them do the same thing where they'll just put out what is due that week. You're going to see there's a quiz. On my announcement, it says no quiz this week. So just to know that whatever assignments are due should be in that information thing. Now, if anybody gets confused, you're not my class, you want to ask me, send me a message. You can also text me on my cell phone. I'm always there to answer those questions so that you don't overly prepare, or like if you prepared for a quiz today and there's no quiz, you're just ahead of the game. That's all I can tell you. Really, you're ahead of the game if you study a little extra. The NCLEX questions this week, be very careful. It is not under pediatrics. It's under growth and development. And then there's a drop down that you put infants, toddlers, preschool, school age, adolescents. 50 questions. It is not in pediatrics, okay? If in case that you put pediatrics and you didn't put growth and development, I know my class, I'm going to put a 0. But in the comments, I'm going to tell you you didn't do the correct one. I'm not going to deduct. I'm not going to keep that 0 if you give me a new set of NCLEX questions with the proper growth development, infant through adolescence. Okay, so basically I give you an extra week without deduction because I know you guys, 3 classes, you're a little bit crazy. I'm going to give you benefit of the doubt. It's usually only 1 or 2 students every term. So I will still continue that where I'll give you that chance to get it done. So the way I do the class, I'm going to do a PowerPoint on school age. I'm going to stop the PowerPoint and I'm going to do a Kahoots on only school age. I have found that doing that really, really helps. Quiz grades are better. Exam grades are better, and even NCLEX, HESI, because you are getting that instant test on not a mishmash of information, a specific group, a specific concept. This is all school age. This is all adolescence, and you're going to see which concepts are the most important. So I redid that last term. I'm always redoing something because I'm trying to figure out ways to help you all. And a student told me to break up the cahoots in between the lecture. So this is from a student. So anybody has any suggestions for me, I'll listen to them. If it works, I'll use it. And I am so glad that I followed this student. So let's go ahead. Let's start with our PowerPoint. Again, these are always in your announcement. All right. I also, with my class, I always reattach it to your recording. So week 3 information, you have what we're going to do and what assignments, and everything is attached there. You've got a school age adolescent worksheet to work on to look at different concepts. It's a good thing to look at. Then you've got your PowerPoint, and I'll put the Kahoot links there. So all of that will be there. The class that I'm covering tonight, all right, with Professor Paige Chismar, I'm going to post your announcement. You're going to get that probably by 7 o'clock tonight, because that's just me. Not 7 o'clock, by 9 o'clock tonight. Class is till 8. Anyway, so you'll be getting the same thing. And that will be in my recording. So let's go ahead and let's start out with school age children. Well, first of all, what are school age children? School age children are usually defined as ages 6 to 12. Now, my dissertation, my PhD dissertation, was on school age children. Sometimes you see it 5 to 11, sometimes 6 to 11, 6 to 12. The dates are a little bit crazy, but according to our book, we are 6 to 12. So that's a broad amount of time. So we start out being a small, child that needs help, and then they're 12. Now they're almost adolescents, and they're fully functioning, thinking humans. So this is an incredible amount of time to look at. It is slow and steady growth. This is not where you grow this great big thing that you did as an infant. This is slow and steady. They get pudgy, they get taller, they get pudgy. You can watch school age children grow. School age children start with the end of all of their baby teeth in, and then they start getting rid of them all. And by the R12, all their permanent teeth should be in. And we're probably going to be starting, with going into puberty by the end of school age children. One of the things you, as nurses, if you ever go into pediatrics, you need to be careful with is looking at a child, and some of them look old. And I'm going to give you a good example because it's so close to home. I've got a 10-year-old grandson who looks 18. He is 5'4", 160 pounds, and he looks 18, but he is mentally a 9-year-old child. So be careful addressing adolescents, or even especially school age children, because what they look like physically doesn't match what they are here emotionally. And that's what that is all about there. So 2 inches a year, 1 to 2 feet for 6 years, okay? We are also going to see their weight doubling by this. You don't need to know all the numbers. You just need to know a slow and steady, and know that boys and girls are basically the same as school age children. They don't change till the end of school age adolescence. We know children, when they're first getting up and walking and running, they're clumsy, right? And they fall down. Well, now they're becoming more graceful. They're able to, their legs and their arms are start to stretch out. They are getting stronger. They are face is changing. And we know at age 6 is when we start losing our baby teeth. Now, it doesn't mean all children lose their teeth at age 6. I have a grandson. At 8, he started losing teeth. It wasn't at 6, but all of a sudden he loses 6 of them. So this is just part of it. Again, all children are different. So the biologic sort of things, we know that all the body systems now are starting to mature, which means the heart rate's coming down, blood pressure's going up, body's more effective, it works better for that child. The immune system, they've been sick and they've gotten all those immunizations. So they're getting extremely strong against all of these diseases and germs out there. The bones are becoming more ossified, which means they crack easier, isn't it? Because when they're younger, they tend to bend, they don't break as easy. I've already said it, physical maturity does not correlate all the time with emotional or social maturity. One of the things with school age children is we know they're pleasers. They love to please. That's just who school age children are. But if we start seeing them changing, where you had a kid who's good at school and always happy, and all of a sudden they're getting a little bit verbal, they losing their patience, or they're starting with these tummy aches and got to go to the nurse and I don't feel well. This is a change in behavior. This could be showing you something's going on. It could be there's a divorce at home. There could be money problems. They could be having physical abuse, mental abuse. Any of those things could cause this child to act differently. And if they do, it's something that you need to think about. A change in behavior on a school age children that drastic, you need to find out why. Now, prepubescent. So boys and girls are about the same. But at age 10, girls usually start through puberty. The first puberty in children is, nipple buds. It's the first thing you see. Boys is an enlarged scrotum, starts to get bigger, okay? But girls are 2 years before boys. I remember at age 10, I was in fifth grade, and I remember thinking, oh, I had this little Anthony. I remember his name, Anthony Congelosi. I don't know why I remember that name, but I had a crush on him at age 10, and he was like, oh, girls are stupid. Well, now I know why. Because mentally, puberty wise, was like really excited or interested in me yet because they haven't gone through puberty because boys are 2 years after me. So boys are saying, ooh, girls are stupid, and girls are going, he's cute. I want to hold his hand, right? I want to go out with him on when we go to the playground. So assessing children. Now, adults, we do head to toe. Don't think you're doing that with a child. No age child, because they're not going to do what you want them to do, because children have their own mind. So first of all, you got to get down to talk to them, get on their developmental level, use simple terms. Remember, a 6-year-old is going to get different explanations than a 12-year-old. A 6-year-old for an x-ray might say, hey, we're going to have this big camera, take a picture. And that's okay. A 12-year-old, I might say, you're going to go for an x-ray, we're going to look to see if that bone's broke. There's a difference, and why? Well, a 6-year-old boy might think that big camera and that thing is going to put out a big glob of radiation and cut a hole in the middle of his chest, because that's where their minds think. Superheroes, Spider-Man, Superman, and all those things, right? So again, on their developmental level, you have to explain. You can look at a kid, well appearing, sick appearing. That's the first thing I always do. The kid's smiling, happy, running around, I'm not so nervous. But if they're not moving, sucking their thumb in the corner, that's the kid I'm going to be scared about. When you look at anything like the abdomen, first of all, you look at it first. Is it rounded? Is it looped? Is it flat? Then you listen, you touch and palpate it, okay? I'm in my cahoots. I think you've already had it twice. Lymph nodes should not be visible unless they're sick. Because what are lymph nodes? They produce antigens to fight disease, right? So if you're not sick, do they have to be enlarged? No. And that's how you remember that. Another thing is doing an assessment. So you did all that health assessment and you did your assessments and you passed that in your labs, right? Remembering that hypoglossal nerve, we can stick our tongue out even on infants. We can get them to do it. I just had a new infant in my life. He's actually now 9 months old, but this little child, in fact, that was yesterday, he was 9 months old. Oh, I forgot to wish him happy birthday. But this little boy, since the initial thing, would stick his tongue out. They like to imitate, right? At 2, 3 months, imitation. So again, you're testing that hypoglossal nerve is working, which is part of your assessment. Another thing with assessing children is breath sounds. Now, we know infants, we need to have that parent have them holding them asleep, quiet, and we can hear breath sounds and heart sounds. In older kids, you don't need them asleep, because you can instruct them what you need them to do. Remember, if we take a stethoscope and listen to the lungs, we could hear a lot of bronchi sounds. Children get a lot of upper airway mucus. So listening to those upper airway sounds, it could be just mucus in the airway and the breath sounds are clear. So again, put your stethoscope over the trachea, substernal notch, because we can assess, is it bronchial, upper airway, or is it the lower airway? So one of the big things on this first exam, there's like about 7 questions on it, is all about theorists. Now, there are several ones that you need to know. Freud, anything sexual, anything sexual. But what does Freud say about school age children? It's not the one that's oral or anal or, prepubescent type thing. This is latency. Well, what does latency mean? It all means it's a period of time where they're trying to explore and understand. And it's same sex peers. They talk between each other, I guess, talking about, life and girls or boys or whatever. But it's a time where they are in same sex peers. And that's what Freud says. They need that. They need that talking. Now, Erickson. Erickson is about a child and the people and how they respond to that child. Well, we know that an infant gets the people around them to come to them when they cry, right? And they trust that when they come and pick them up, now they trust. And that's what Erickson in your infancy is. But in Erickson school age, again, it's another name that like, ooh, what does this mean? Well, it's a sense of industry. Well, let's look at that word industry. What is that? It's a factory, it's a product, it's something that they produce, it's an industry, right? What do children do? Oh, they're going to do everything to try to please, right? We also know children do something very well, or several things well. It could be playing the organ, it could be running the fastest, it could be the best speller, the neatest handwriter. They do something really, really, really well. And what that does, it makes them feel good, and everybody around, oh man, you're the fastest runner, and they feel proud. But can you do everything well? No. So you are now with an industry, you do really good. Your factory, your product is so good. I'm the fastest runner, I'm the best at math, but I'm horrible at spelling and I hate to read. So that's a sense of inferiority. What does that mean? I want to do everything well, but I can't. And I can't do everything well, and that makes me feel bad. So I feel inferior. Do you understand my product? Industry. Inferior, I can't do it all. And it makes me feel bad. You'll remember that now. Now, Piaget. Piaget is all about thinking. Well, let's go back to the infant again. Infants at birth don't know how to breathe. We smack their butt and they go, oh, and they learn how to breathe, don't they? We stick something in their mouth, they learn to suck, swallow, and breathe. And now we're putting milk in their mouth, sucking, swallowing, and breathing, feeding themselves. And then they get the rattle. It's a reflex. Oh, and then it becomes voluntary. And then you rattle it and it makes a noise, and we put it in our mouth and we like it. We've learned it's building up all these schemas, it's called. All these little things that have to be done to understand. Now, school age children. School age under children are starting to understand relationships between things. Like, for instance, organizing a closet, all short sleeve, all long sleeve, all, red things, all blue things, all dresses, all skirts, all pants. It's organizing things. They understand the differences. They're the same, but they're different, right? They also, when you get two 8-ounce glasses, one's tall and skinny, one's short and fat. They're both 8-ounce glasses. A younger child will pick the taller glass because it looks bigger. As school age children will say they're the same. They're both 8 ounces. They're understanding that difference. And that again is learning, is understanding, okay? This is basically showing you different things. The glass, a ball of clay, you smush it, it's still that same ball. You take pennies, whether they're organized or not, there's still the same amount of pennies. That's what they're trying to tell you. Younger kids don't get that. They don't understand that. So, cognitive, concrete, operational thing. All right. So, this is basically all of that understanding. Use it, concrete, operational. You understand it and you can work with it. So, I understand there's an organization skill. I'm going to organize my closet. I'm going to organize my toys. I'm going to organize my hair clips. Whatever it is, we can do that, right? Now, the fourth operational stage is the end, okay? And when we are school age children, we have to be shown something first. Concrete. I've seen it, touched it, felt it, did it. I can replicate that. I can do that again. Formal operations, the older kids and adolescents, they can figure their way out of a paper bag and they don't have to see it first. I was a single parent when I had two teenagers. And let me tell you, the stories they come up with are quite amazing, aren't they? Because they want to get to that, the basketball game on Friday night, but they failed a test, right? And you're like, you don't go anywhere because, you have to at least pass your grades in order to have any privileges. Well, they're going to take out the garbage, make their bed. They're going to bring you coffee in the morning. They're gonna, whatever, and tell you everything. In the end, it's a possibility you might let them go because formal operations, they can figure out how to get what they want with never seeing it or hearing it before. That's what that means. Formal, adolescents, older school age children, concrete. I have to touch it, feel it, see it in order to be able to say it, do it, feel it, whatever. Now, the other theorist is what we call Kohlberg. Kohlberg is all about right and wrong. Now, infants and preschool and toddlers, they don't understand it. They just do what they want to do because they want to do it. Remember, the toddlers, me, mine, I do, I do. You ain't going to tell them what to do, right? So they don't understand right and wrong yet. Now, when they get to be preschoolers and then into school age children, preschoolers understand reward and punishment. All right. School age children, they just want to please everybody. They are pleasers, like I said. They conform to rules to please. They're going to do what the teacher wants. They're going to listen. They're going to line up in line. They're going to put their books away. They're going to this, to that, to that. They're going to do everything right. Okay. Now, spirituality and spiritual development, again, concrete terms. They had to see it, touch it, feel it to understand it. They had to see the Christmas tree, go to church, see the manger, whatever it is, whatever religion it is, they had to see it, touch it, understand it. And as school age children, they can do that. And they really want to know who this almighty, this person who's above them is, whatever the name that you have for it, okay? School age children do understand if they do something wrong, they're going to be punished. They do understand that. Okay. And another thing that I have seen, especially in the school age, especially the younger school age children, is they think that they broke their leg or their appendix busted because they did something wrong. I can't tell you how many children came in with an appendix, young school age children. And I sat down with them before surgery because I know what school age children are like. Number one, they feel guilty, they did something wrong. And number two, just like the preschoolers, they think they're going to bleed to death. They're being cut surgery. So they need a big band aid, right? So before surgery, I would sit with these children and say, you didn't do anything wrong for that appendix not being there anymore. Sometimes body parts break down. You don't need it, so we're going to get it out. But I'm going to tell the doctor put an extra stitch in there to make sure your insides don't come out. And you think that's crazy that I tell these kids that, right? You should watch their shoulders drop and how they relax. It gives them a better mental attitude before surgery. Now, as I said, school age children love peers. Again, same sex peers, school ager. Okay. And again, we're starting to share ideas and activities, and now they're becoming influence on these children, right? Not only the children, but the parents or the adults that surround, whether it's a group leader of Girl Scouts or a mother of another child. Again, now you're starting getting a lot of people and influences on them. We know school age children loves 4-H, and they love Girl Scouts and brownies and groups. They just love those things. The problem with those groups, with any sports or anything, is that there's always going to be that person who's that bullyish. I got more medals than you did, or I this and that and you can't. And it's just part of children. So again, parents need to be an adult and listen and ask their children when they were at this, if anything happened. You need to keep in touch with those kids, right? We know that children are trying to be more independent from their parents. We know that, but they also need to still know what what their value system is. Now play. You think that's only young kids, right? I still play on my little words game on the phone. So even old people play, games every day, right? Play. What is it good for? Well, play gives rules and rituals. It's like going to work. You have to do certain things and you got to get it done. It's certain rules and rituals, right? It's working with other people, team play. And sometimes it's just working by yourself. And that could be, that quiet type of thing. Or, these are things that, you're looking and you're reading and you're becoming happy with yourself and how you're doing it, whether it's your knitting or anything, right? School age children are starting to understand what they're good at, what they look like, what they like about how they look, right? They're starting to understand people coming up and say, oh, you've got such curly hair. I love it. Oh, your freckles are so adorable. Oh, your cheeks, I just want to pinch them. They're starting to understand and they're starting to want this praise. They're starting to understand differences. Younger kids, think about that. They don't understand blonde hair, brown hair, red hair, curly, short, fat, skinny. Glasses are now becoming, as the children getting older, maybe hearing aids, some of the kids. All of these things are starting to understand differences. So children are preschoolers, and hopefully they got into a preschool, and now they're going to start going to school. Now, what does school do for these children? Well, now we have another adult telling our children what to do, influencing them with their culture, which is part of what happens. And you have other children, and they're influencing all their type of different values that they have in culture. So we're starting to learn a lot more. And now we're breaking away from mom and dad. So we've got to listen to somebody else and sit for an extended period of time. Nutrition, 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 nutrition. So you think nutrition is important for a school age child? Absolutely. As an infant, we need it to grow, right? As a school age child, you're not growing as fast, but cognitively, you're growing in leaps and bounds, aren't you? And if you don't feed the tank, you're not going to be cognitively where you need to be because the gasoline in the tank is low, okay? We know school age children are the best group to teach. So is nutrition important to school age children? Absolutely. And it is the schools and whatnot's responsibility. We start to teach them about food. We know, yeah, they like certain foods. I mean, the toddlers are the chicken nuggets, macaroni and cheese, and apple juice, right? I mean, school age children might be pizza and hamburgers or whatever, but there are certain things kids like and there's things they don't like. One of the things about nutrition in school age children is today, most parents both have to work and sometimes more than one job in order just to put food on the table. And it's a reality. It means that meals might be that quick drive through and pick up some food, which we know the nutritional quality isn't as good as we want. High fat, high carbs, et cetera, et cetera. But if children are taught about that, they can make better choices. Another thing they have on the internet is something called My Plate. And school age children do work with this on looking at the food groups. Are they eating the proper food groups and getting them aware? So today, we notice at school age children, we usually not before this, it's usually when we get to about school age children, we start to notice that children can be overweight to the point of obesity. Why? It's, reaching epidemic proportions today. Part of it's because parents can't have home cooked meals or can't afford all the fresh fruits and vegetables and whatnot they need in order to do that My Plate little, getting all the good stuff in there. It's just part of it. Another thing is today, kids are not going. When I got out of school, I went home, changed my clothes, and I went out playing. playing basketball, running, riding my bike, whatever. Today, the environment doesn't let us, number one. And number two is we've got all of these other things to occupy ourselves. We've got our computers and our phones and our pads, and we're playing games and constantly communicating, which means we're not out running and walking and burning calories, okay? If we allow school age children to become overweight and we don't educate them so they can make changes, that will lead to an increased risk of hypertension, diabetes, and high cholesterol as adolescents and as they get older because they're overweight. And why school age children? Well, we have found that early education, those school age children, can be a great assistance in preventing them from getting overweight and getting high blood pressure, cholesterol, et cetera, et cetera. So obesity and prevention should start with mommy, right? Feeding the baby when she's pregnant. Then as the baby gets out and now we're an infant, watching the weight, making sure they're getting the proper nutrition. We know that if we can increase a kid's activity, getting them burn off calories, we know that that can help. But, it's not an ethnic group, it's not a culture. We're all the same when it comes to eating and obesity. One thing that was mentioned was school age children about sitting down and eating dinner, lunch, whatever. And there are some parents who don't let that kid get up until they finish everything on their plate. They become adults that will finish everything on their plate. Guess what? That adult's going to probably be overweight because the parent has forced them into, I have to finish what's on my plate. There's kids that are starving in Ethiopia. I mean, that's what I used to always hear, right? So, children, as 6-year-olds, it's going to be a little different than your 12-year-olds. 6-year-olds will sleep a little more, and it's going to be really hard to get them to bed sometimes because young kids, they want another kiss, another glass of milk. I got to go to the bathroom. I got this. No, but that is younger kids. As they get older, they're tired. They just go to bed and they don't really care. And it's still about 9 to 11 hours. I've mentioned sports and I've mentioned all of these things that kids can get into. Know that there is controversy with it, whether it's other children, other parents can be pretty rough too. Oh, you dropped that ball. You made us lose that game. We need to think about these parents doing that. And as parents, teach them that they should be there and be aware of what's going on so they don't feel bad, right? We know kids love competition and they want to win. They always want to win. Ever play a game with a 6, 7, 8 year old and, playing checkers and they want to win. And if you win, they get upset, right? Like, well, play it better and you can win next time. We know that the internet, it really influences children. Dental health. Well, remember, all their baby teeth are coming out. They're all in by age 6. And age 6 now, we're going to start losing everything. So losing teeth is normal. It doesn't mean they have bad dental care. But if there's a pain in the tooth, it's probably a cavity. All right? We should brush their teeth before going to bed. They should floss. But the book tells us that it's difficult for the younger school age children to floss. They don't have that dexterity yet. I mean, they've got those little tooth things now. Maybe that will help. But the book, with those little things like that, they say they don't have the dexterity to do it yet. So it's after age 7. What happens if you have a tooth that's knocked out of your mouth? Well, one of the things about that is if it's the whole thing, bring it to the dentist or an ER that has pediatrics, and we can get that tooth put back in, especially if it's a permanent tooth, especially one of the front teeth. Now, school age children, they're getting more and more alert, especially if there's other brothers or sisters being born in the house. So sex education is going to be an important conversation. It is absolutely normal to ask questions. It's absolutely normal to feel themselves in masturbation. All that is absolutely normal at this age. We know about middle childhood. So you're talking 8 to 10-ish. That's a great time to start sex education, to let them know, and giving them information. The nurse's role in sex education is basically find out what they know and answer specific questions, and then keeping conversation with the parents so they know what's going on. School health, school health nurse does a lot. I mean, those of you and Professor Pace Chismar hears the stories about schools and the responsibility. I can't imagine have been a school nurse when COVID broke out and all the responsibility that came, because it was on the school nurse to get them information and to protect, along with administration, right? There are other times that I have seen where we've get bacterial meningitis into the ER. We've got to notify that school and that school nurse so they can send out messages to say, hey, your child might have been exposed to such and such, and you need to get prophylactic antibiotics. That's what we do for bacterial antibiotic. A dose of an antibiotic, that's all they need, and we can help them. Also, what if they have ADHD and they need help? Well, we can get the school nurse to give them a referral, to show them who to go to, give them information again. Now, injury safety is always going to be around there. You need to know a little bit about injury and safety in all age children and adults for when you're talking med surge. But most common severe injury for all ages, infant to adolescents, motor vehicles, whether they're in a car seat improperly or not in a car seat, or they're ran over, or now they're driving. So, I mean, it's all ages, okay? A factor for injuries is that stressful family life. That's when you see the change in the behavior and maybe health problems that are coming out. I mean, something's going on, and they're probably, because they're not thinking right, get more injuries. They say all children should be in the rear seat till they're 13. I remember when I got a divorce from my children's father, my children were 9 and 11. And they used to call shotgun because we didn't know about that back then. My kids are 40 and 41 now. So, again, rear seat till age 13 is just protection. They should be in a booster seat until age 8. Now, I live in South Florida, Homestead, which means I've got the Everglades and I've got farmland like crazy west of me. And there's ATVs all over the place. They recommend it not for children under 16. Now, why? Well, they ride bikes everywhere and stuff like that. Well, an ATV is a motorized vehicle. What happens if they get lost? What if it flips? What if an engine something goes on? They don't want a child less than that. They don't feel they could handle the situation. Always remember safety equipment, okay? Know that they should have helmets on or wrist pads or elbow or knee pads for, skating, et cetera, et cetera. Again, safety equipment. So children are growing, and parents want their kids to stay babies forever, right? But they're not. They're going to become more and more independent. And as parents, what they say is to provide support as unobtrusively as possible, as in be there and watch, but be quiet, look and listen, right? We know children are now moving away from just family. Remember, they got family, they've got friends, they've got teachers. Now they're opening their horizons, their mind, their relationships. ADHD. I mentioned this about the school nurse, and she could put in a referral about it. One of the things that I've seen, and I've seen it even specifically with a very dear friend of me. In fact, she was my charge nurse in cardiac ICU. Her son had severe ADHD. And I saw what she went through with the school system trying to get this child the help that they need, right? They thought he was just a spoiled kid and wouldn't listen. Well, again, as nurses, if we're a school nurse, we get a kid with ADHD, That could be what we would think too. So I caution you. First, don't say, hey, your kid is da 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 da. Tell me, what have you noticed with your child at home? I've seen they've been a little bit restless at school, disrupting the classroom. What have you noticed? Figure out what they've done. Kid could have everything, every privilege taken away at home, trying to get them to do what they need to do. But as a nurse, you don't know that. So let them talk first. Then a nurse and the parent get together, and then they can make a plan of care. What is the best for that child? Enuresis, what is that? That means bedtime wedding, right? We're going to do that more in your GU chapter on week 8. But again, enuresis, we got to find out why. Did it just happen, or is it been continually going on? And we'll go into that a little bit more. Acoparesis is constipation. Now, in week 8, GIGU, you're going to hear that the only thing young children can control is their bowels. And I've actually seen them hold them up to 2 weeks. Seriously, no stool. And when you take the x-ray, you see it boom, boom, boom all over. It's like lit up with stool. It's that bad. So again, we're going to look into that, and it's something that we need to look at. So you've got a kid, and I can't even tell you how many knocked out teeth I've seen. A child has an avulsed or a knocked out tooth. The parents are reluctant to try to reimplant the tooth. Where should the nurse be placed for transport? Remember, the end of the tooth is a live root.
In cold milk.
It is. It
A.
is cold milk. And I don't know why cold, and I don't know why milk. And I've researched it like crazy. The only thing I can think of is cold keeps it warm, will give it, bacteria can grow. So cold will stop that. And I think milk is the calcium in it. If I had to guess why.
So
All right, let's do it.
I
Good.
worked in a pediatric ER, and we always told the parents that the cold was to desensitize the nerves and preserve the nerves, and then the calcium was milk.
Perfect. I worked in a pediatric ER forever, for 10 years. And I've not heard anybody say that before. So I guess my thinking was correct. Thank you. Mystery solved. If another person tells me, I agree. All right, who wants to win the first Kahoot? You want to go class to class? Pace Chismar versus Bogart's class? Let's see who wins. Yes, I'm a little bit crazy, guys. It's all right. I don't want to grow up. I'm a Toys R Us kid. Ever hear that? And I think the person who loves that most is my 9-year-old grandson who lives around the corner. Remember, this is your review week. I'm doing my review tomorrow at 3 o'clock. Yes, it's going to be posted. Yes, you can go to my YouTube channel. It's always there. You can look at previous ones. You can look at any recording. Those in Pace Chismar class, you ever want to see my recordings? You ever want to look at something? It's Professor Bogart, Pediatric Nursing. It's a YouTube channel, and it's public. Now, I don't look at these games after I'm done. These games are here to test yourself. So don't think if you put your name up there, I'm going to say you had 28 out of 29 wrong. That's not what this is for. This is for you to test yourself. And when you're seeing yourself not understanding, write that concept down and you can look at it more. Or you can ask me, send up a tutoring session, say after class, come before class, whatever you need. All right, let's get going. School age children. There are like 20 some odd questions here. 27. According to Kohlberg's pre-conventional level of moral reasoning, a preschooler who has moral reasoning. Remember, school age are pleasers, right? What do preschoolers understand about morals? So preschoolers, they understand there's good and bad things we can do, right? But there's a consequence for each. I do a good thing, somebody's going to praise me. I do a bad thing, I'm going to be punished. The other way we call that is reward and punishment. So it could be said in either way. Remember, school age just want to please. And infants and toddlers, they don't have any morality yet. They don't understand right and wrong. In which of Erickson's stages do children begin to understand conservation? That's the two glasses, the two 8-ounce glasses, the pieces of clay. That's organizing my closet in short sleeve, long sleeves, reds, blues, and all those things. Erickson. So conservation is school age. School age children, it's concrete. I have to see it, touch it, feel it to be able to understand it. That's the understanding because now I've seen it before. Concrete. Very good. Remember, formal, you don't need any understanding. That is your adolescence. According to Erickson, industry versus inferiority begins at age what? Erickson. What stage is industry versus inferiority? It's school age. And that's ages 6 to 12. Remember, they feel inferior because I can't do everything well. And remember, the industry is their factory, their product. What do they do really well? Whether it's running or math, spelling, whatever. A multi. Erickson, industry versus inferiority. What is it? So as explained, I do something well, but I can't do everything well, right? So I do something well, I feel confident. Now, can't do everything else well, so I'm going to worry about what I do well. So you have confidence. I run fast, I math good, and I feel good at that, and people tell me about it. Very good. What is a common sign of stress in school-age children? So one of the things that we can see is those physical things, that stomach pains. The other things we could see is being aggressive and, being disruptive. Those things also were the stress. Hyperactivity, not necessarily. A multi. What are signs of stress in school-age children that need to be investigated? So if you have a school-age children who has been potty trained, and all of a sudden they start wetting their bed, something's wrong. Whether it's emotional or physical, it could be diabetes insipidus, diabetes mellitus, could be urinary tract infection, could be a lot of stuff, right? So we got to find that. Also, what do children do when they're stressed globally? They regress to early behavior. They start sucking their thumb, right? Or all of a sudden they wet their pants. I mean, this is what happens when stress. Very good. A multi. Safety education for the school age child might include so we have to teach them about bicycle safety, and that has to do with riding in the street or even helmets or knee pads, whatever you want. Water safety. I've got a pool in my backyard, and I've got a grandson who spends a lot of time here. At age 2, this little kid was no swimmies, doing front flips and back flips off the diving board. He could and knew how to be safe, and will never, ever, even today, he's 9, will go in the pool without asking first. He knows better because water safety is, South Florida, I've seen a few drownings in my life, and they are not fun to witness. Of course, motor vehicle, we get that, car seats, etc. And of course, firearms. They like to play with stuff. Dental care typically begins around what age? Dental care. You get teeth. When you got to worry with them? Do we worry about baby teeth? Yeah, we do. So about 1 year of age. I'll tell you a little story. My firstborn, my son, they didn't have sippy cups that years ago. So he would take the bottle and put the nipple in his mouth with his apple juice and go like this and run around the house with it. He rotted his front teeth out. Before I knew it, his front teeth were rotted. And of course, we should have done dental care earlier, but I was a young person and I just didn't know.
Now, see, my daughter is 18 months and they told me not to schedule her for the dentist until she was 2.5. Because I tried to call to schedule and they were like, well, how old is it? And I even called a pediatric dentist and they were like, how old is she? I'm like 18 months. And they were like, she's way too young. Bring her back when she's 2.5.
Really? Find another dentist. Find another dentist. Wow. What happens if something is going on, right? And then it becomes more of a cavity and, it becomes more of a traumatic thing for the child. That's what I look for. So thank you for telling me that. According to Erickson, trust is to blank as identity is to what? So now you need to know which one's which. And I've explained them today. Erickson is how the child responds to people around them. So trust is to mistrust as identity is to childhood, right? It's to, your identity is, who am I going to be? What am I going to be when I grow up? And that goes into the adolescence there. Very good, guys. How does the onset of pubertal growth spurt compare in girls and boys? Puberty, girls, boys, what's the difference? They're the same? They different? Remember, girls want boys when they're 10, right? Like my little Anthony Congelusi. And boys are like, ooh, they're stupid. Girls are stupid. It's 2 years different. Earlier in girls. What age-appropriate activity should be included in the teaching for a 6-year-old child? Now, school-age children, what they say is these kids, you should never give them something, Erickson says, that they can't achieve. No way. You want to give them something that gives them a challenge, but they're able to solve it, right? And be able to do it. So age-appropriate 6-year-old is jumping a rope. A large jigsaw puzzle is not enough for them. Hopscotch, maybe, but the jumping rope is the more coordination. And we don't want them in any competitive sports yet. It is said that they're too young. They can't handle the stress of it. Although I know they're doing this T-ball at 4 years old right now. I understand that, but parents need to be there. It's hard to be in a competitive sport that young. They emotionally can't handle it. How is chickenpox spread? Varicella. I don't know why they like it, but they pick on chickenpox in exams. They do. Working in the ER, a child would come in with a fever, cough, and they rash at various stages of healing. That's the thing, various stages of healing. It's chickenpox, and it is that when it's oozy and open, it's an airborne thing. It's in the air. So you get a child, let's say you're urgent care, your ER, your doctor's office, doesn't matter. You're working with kids. You see a child, fever, rash, different types of healing. Some are just up and some are healing. That difference, put a mask on you, N95, and then get that child into a room which is not going to give that chicken pox, varicella to anybody else because it's airborne. It's in the air. And it is serious. Even if you have the chicken pox vaccine, you still can get chicken pox. A multi. At what point is a child with chicken pox not considered contagious? When can they go back to school? So, no new eruptions and everything is crusty and dry. Also, no fever. Itching, kids will itch. It doesn't have to do if they're dry or not. That has nothing to do with contagious. It's all the others. Which age group characteristically plays with same-sex peers? Isn't that Freud? And that is school-age children, ages 6 to 12. Culturally competent care includes I moved to Miami and all of a sudden I was dealt with so many different cultures that I had never seen before. And it was difficult at first. But what I have found is if I don't understand something, I'm going to ask an older child or the parents, tell me, is there any special things that you do need? Right? Because how am I going to know any cultural beliefs? How am I going to understand maybe they need a vegetarian diet or they need time to pray or they need a this or they need a that? And I have no clue because it's not my religion. It's not my culture, but you have to let them be able to practice it as long as it doesn't interfere with the medical care. You don't have to believe in them. You don't have to believe in what they believe. You only know your own spirituality. I know who I am. That is who you are. I don't have to believe in it. I've just got to give you time. I've got to give you the space you need. True or false? Flossing daily is recommended for good dental health. Absolutely. Does everybody floss every day? A 6-year-old needs to get a chest x-ray. What explanation is best? Let's get out those gamma radiation rays and zap that chest, right? One thing that I got used to, and we were lucky we had a computer in every area, every room, is I would always show the young kids pictures, whether it was a broken bone, whether it was a pneumonia, whether it was constipation, it was stool. I would always show them the x-ray so that they would understand it. So again, getting on their level, giving them an explanation they understand so they don't see this big machine going click, click, click as they move it around, and it could be scary. A 6-year-old will run down the hall and out to the parking lot. So get them prepared and make it simple, simple, simple for them. Care for a knocked out tooth. My tooth got knocked out. What do? Mom calls. Her 10-year-old, oh my goodness. I chipped my tooth. Nothing I could do with a chip, right? If the whole thing came out, could have reimplanted it. So, knocked out tooth, you put it in milk or saline and get to the doctor. And the key thing is cold milk is absolutely the best. If you only have saline, at least it's something. Cold would be better. Which thought process involves logical thinking for the school-age child based on developmental theorists? Thought process, school-age children. Logical thinking. You have Freud, you have Erikson, and you have Piaget here. Who is thinking? Thinking is formal and concrete operations. Concrete operations, school age, because why? I have to touch it, feel it, see it, hear it before, and then I can use it. Remember, formal is I can figure it out myself. All right? F for F. I can figure it out myself. A multi. Erikson school age. Which is Erikson here? School age. So we know Erikson says school age children do things well, but they don't do everything well. So that's industry versus inferiority. They like that sense of accomplishment. They like that sense of industry because what they do, they can produce and they do it well. Whether it's math, whether it's playing a flute, doesn't matter. They do something good. As I said before, they have to be challenged, but it needs to be a task that can be, with time and patience, can be done. You don't want to give them something they'll never be able to finish, right? Also, they like praise. And we know that not everybody can do everything. You could teach kids how to do something. Doesn't mean this kid does it well and this one can't. And it's absolutely normal. So that's Erikson, the most tested theorist on your HESI and NCLEX. According to Kohlberg's conventional morality, school-age children believe what? Kohlberg, what do they believe in? Remember, morality, school-age children. We start out with the young ones, infants and toddlers. They don't have morality. They do what they want because they don't understand right and wrong yet. Then we get to preschoolers. What are preschoolers? Reward and punishment. We get to school-age children is they like to do things right. They like to praise, they love those things. They like to do good things. Anorexia nervosa. I put a couple slides in here on some eating disorders. I don't always put them in the PowerPoints, so I just want to introduce it here. This could be older school age, and this could be your adolescence. What is anorexia nervosa? It's an eating disorder. And what happens is they put absolutely nothing in their mouth and they exercise like crazy to burn off that one little piece of lettuce they ate. It's basically starvation. It's a problem where they don't see themselves as thin. They think them body dysmorphia. They just think that they're too fat, la, 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 and they tend to just not eat. It requires really good care, inpatient, outpatient care in order to help these children. And it is hard because they believe they're fat. They don't believe they little piece of something, they're going to gain weight. And they have this real bad anxiety about it. Which signs may indicate that someone is struggling with bulimia? Now there's anorexia nervosa and there's bulimia. What's the difference? So bulimia is still where they're losing weight like crazy, but this is the person, and it could be from the young school age up to adults, where they eat like crazy and they throw it up because they don't want it to digest. So these children or adults will be eating enormous amounts of food, but they'll be getting rid of it as they go, okay? So they're vomiting a lot, so their throats hurt. Also, they're vomiting a lot. Stomach acid is going to burn their teeth. A lot of them have rotten teeth. So if you're looking at eating disorders, looking at the teeth, you'll be able to figure out, are they anorexia nervosa or bulimia? Okay. And this is the child, the adult, that right after they eat are running to the bathroom because they want to purge it, get it out of there. Which of the following could be a sign of potential child abuse or neglect? So, child abuse or neglect. The biggest thing is unexplained injuries or bruises or an irregularity between the injury and how it happened. And sometimes you'll get the mother and the child different stories, and that's where you catch them. Remember, as a professional in nursing or even not, your responsibility is to keep the child safe. I've told my class I've seen child abuse and it is not nice. And you want to beat up the person who brought that kid in. But being a professional, then getting the proper authorities in and keeping the kids safe, that's what you have to do. And it's what I had to always remember. Cooperative play. Who's that? What's that? I guess we're playing again, huh? So in this exam, you're going to have parallel play, associative play, and cooperative play. Cooperative play is the highest level of play. Two or more children playing together. There's a goal. Somebody wins. You built the fort. You built the racetrack. You won at checkers. That is cooperative play. Associative play, they're all playing together, two or more kids, but they're not building anything. There's not a goal. They're all doing their own little thing. And remember, toddlers, me, mine. They're parallel to each other, kids, but don't touch my toys and I'm not going to touch yours. Parallel play. You need to know those three types. What type of play is considered cooperative play? That's supposed to say race car. I guess I got a little bit dyslexic there. Playing checkers. And why is it that? It's because there's a goal. Somebody wins. Sharing toys with another child is associative play. Okay? You can play together. That's associative, but there's no goal. They're just playing, which is fine. That's the younger kids. That's your preschoolers. Last question here. What two common sign symptoms can be found in children at ADHD, attention deficit hyperactivity disorder? I still remember Tommy, my friend's son, who fought ADHD, and she didn't want to put him on meds, and finally she had to. We did everything for him. This is a kid who is constantly interrupting. This kid is constantly lack of focus. This is going from one thing to another thing to another thing to another thing, and they just can't finish a thing. They keep running around in circles, and it's very, very frustrating for a child. Number 3 was a Maggie. Good job, Maggie. Number 2, Meg. Good job, Meg. And number 1, who won the game? Overwhelmed. Yes, this is that term for that. Kirsten and Chris, good job, guys. All right, let's go into our next area.
Is it okay
All
if we
right.
take a break? I have to just use the restroom, or if I could just use the restroom.
Go ahead, use a break to do 5 minutes. We'll come right back. How's that?
Thank you. Perfect.
I think I have to go too. Don't everybody feel a little bit better now? Oh, we're going to go ahead and we're going to go to our adolescents now, okay? So school age is hit pretty hard. As you can see, there was a lot of information there. Again, the Cahoots is giving you those concepts that you're going to see over and over again. If you can do the Cahoots, you can answer them. You're going to be okay with your exams and quizzes. So let's go over and let's now look at your adolescent. So adolescents, who are they? Adolescents are those kids who are over 12, and they say up to 21, most pediatric hospitals. So this is your older children. These kids were kids, and now they're turning into adults. They are going through rapid physical, cognitive, social, and emotional maturity. They're going through all of this all at once now. And they're looking at, what am I going to be? Who am I? So, children, these adolescents, they're going to be going through puberty, okay, getting ready so that they can, if they want to have babies in the future and become, adults, right? We know there's primary sex organs, and we know that's for reproduction. We know secondary, all the other stuff that happens because of hormone, the breasts and the hair and all of those things. So, boys, first pubescent change is testicular enlargement. This is according to Tanner, and you need to know Tanner, okay? It's just the 5 stages of puberty. Girls, what's the first thing that happens? All of a sudden, you see these little breast buds, and now you know that they're getting close to going into having their menstruation. Menstruation usually is 2 years after we start puberty. So you start seeing breast buds at 10, probably by 12, they're going to get their periods, right? And both boys and girls should be getting the HPV series. This is when they started them at age 12. It's a 3-dose series that they do give. As I said, this is Tanner's stage. You're going to see this. I've seen it on the Hesse-X. Which stage of Tanner's is this? So I've tried to figure out how can I teach this to you that it makes sense, because there's a lot of information here amongst all the other information, right? So number 1, you're a kid. Number 5, you're fully formed. Number 2 is that first stage, which we know is breast buds or testicular enlargement. So you only have 2 stages, really, that if you had a question regarding Tanners, you would know if it would be those 2 ones you might have to guess at. But 1, 2, and 5, you know already, okay? So again, Tanner stage, what is it? It has to do with the development of the child into puberty. So, adolescence.
Professor Begbert?
Yes.
I'm sorry. Would you be able to send that chart out like you did for the Ericksons and all that
Sure.
for us to print out?
Sure. I could do that for you. No problem. Let me write it
Thank
down
you.
on my list to do. No problem at all. In fact, it's a great idea. Okay. Physical growth. We know that children did that slow stuff going up into childhood, right? That 2 inches per year. Well, when they get to be adolescent, all of a sudden they go through a 20 to 25% height and weight growth. Okay, just like adolescents when they were infant, adolescents have this big growth spurt. So we know that the kid might be pudgy, and all of a sudden, whoop, they grow tall, and now they're slender. I see this, I swear, at the ages between 8th and 9th grade. You can watch the kid at the end of the summer on 8th grade, and then the beginning of school on 9th grade, and there's a difference. It just seems to be where we start to see they've grown, and now they're becoming more and more mature. So, Erickson, how do they respond to people around them? Well, they're looking for, who am I? What's my identity? What am I going to be? What am I going to be when I grow up, right? Or who am I going to hang around with? Do I like the band kids, the drama kids, the nurse club? I mean, what do I like, right? We're also, as adolescents, about identity. I've got too many pimples. I'm too skinny. I'm too fat. My feet are too big. My hair's too curly. It's going through, I'm going through, I don't like any of this stuff, and trying to like myself. Sometimes it gets so bad. This is a really hard time, and depression, it can happen. Now, what they say, especially with all of this turmoil, emotional turmoil going on with adolescents, that any sign of suicide, and they say that is sleep disturbance, too much, too little, being irritable, eating too much, eating not enough, staying at home, not going out, or just talking about death and dying, take it seriously. This child is at risk for suicide. So, adolescents, they don't want mom and dad anymore. They want the 20 bucks, see you later, and out the door, right? They want to go from parents telling them what and when to do and when to be home. And now all of a sudden they want to have this freedom to be able to come and go. So we know it's this ambivalence between their independence, their parents' authority, right? They have to listen, but they just want to do what they want anyway. So we know that adolescence is, they're always together. They have to be out with your group, whatever they are. So that's intense sociability. But adolescents tend to go through this loneliness also. I mean, ever see a girl, all of a sudden her boyfriend broke up with her, and now, the boyfriend was the group she was hanging in, and now she's not out with it, and now she's really alone, and she's very depressed because of that, et cetera, et cetera. I mean, this is part of that adolescent. It's just a really rough time emotionally. We want to be accepted by our buddies in them, as I call it, our peers. We want to have a lot of friends, right? And it's all about, what do we look like, our body image. We really are aware of it, dressing properly, losing weight, binge dieting, all those things. Parents. We know that it started with parents protecting their children and thinking for them. Now it's these adolescents want to do what they want when they want, and they don't want to listen, right? We call it a major conflict over independence and control. And we know that's in that middle adolescence, 15 to 17, where they're really challenging the parent, coming in at 2 a.m., not at 12 o'clock, or going out, sneaking out the windows. I mean, all of those things, right? What we as nurses could do is either have the parents sit down with them and come to a compromise, and this would be a great place to talk to the school nurse. Have the school nurse sit with the parents trying to help, this child, and the parents talk to each other. Just communicate, right? Peers are the biggest role, the biggest, most significant in your adolescence. We know that adolescents feel strong and powerful and feels good and dependent because of their peer group. Best friends are very important. What they say with best friends is how a person treats their best friend as an adolescent is how they're going to treat their partner of life. So if they're very good to their best friends, they're going to be a very good partner for whoever it is in their future. Talking to adolescents. So we've learned all about getting with preschoolers and toddlers and getting down on their level and developmentally appropriate, et cetera, et cetera. How you can do that with an adolescent? They're basically almost these grown-ups, right? Well, I've seen a couple things that I have done. Things like, oh, I see you have the University of Miami shirt on. Did you go to the game the other day? Did you see them win? Or, oh man, Yankees. I says, you like New York? I'm a Yankee fan too. Little things, listening to music. So who are you listening to? Who's your group you like? Who's this? Have you heard this song or this song? Little things to break open a conversation. That means now you're human. You're not just a nurse. All right. You're not that person who just wants to, what did you do and how can I help you type thing. Another thing I've seen is you have sometimes a male or a female coming in acting like the opposite, right? And the one thing that I would do is I would say to tell me, what would you like me to call you? Usually it's the name that will give you the hint. For instance, I had one of my patients, her name was Rachel. And I said, so what would you like me to call you? She said, could you call me Ray, please? And I said, no problem. Now, I have built up some trust with her, haven't I? Now, I can have parents leave the room. I can do this legally and talk to that child. I have broken now that wall down. I've talked about social, I've talked about school, I've talked about other things to break down the wall and to allow her to talk to me, right? More comfortable. And as they're talking to me, let's say, for instance, and this is a common one that I used to see, young girl come in with urinary tract infection, and most likely it's due to sexual activity, right? But this girl's not going to talk to their mother about that, are they? Well, my mother would kill me if I said anything. So get the mother out of the room and talk to her. So tell me, what's been going on? Listen. The other thing, and this is really important, they're going to tell you things that are going to shock the crap out of you. Things they're doing sexually or whatever. Don't look surprised. And that's hard. Don't like, what are you doing that for? No, don't be judgmental unless something that's going to hurt them, and just let them talk and you can figure things out. You might have saved that child, future urinary tract infections by just telling them it's been shown if you urinate right after sex, it decreases the amount of urinary tract infections. I might have saved on your UTI on that kid, right? And again, another person to talk with these adolescents, we can recommend to parents, of course, school nurse. So children, healthcare, promoting good health, right? It's getting those immunizations, which is that 3-shot HPV series, boys and girls, right? Nutrition. Didn't I just say they grow 20 to 25% of their overall height and weight? So nutrition. What do adolescents normally do? Bottle of water and a power bar and run out of the house. Get their $5 for lunch, put it in their pocket because they're going to use it on the weekend, right? That's exactly what. So they're not eating. So again, they're going to be mineral or vitamin deficient. So be aware. One of the ways that we regulate nutrition, school age, adolescents, is by going over their diet. Any food diary. What did you eat this morning? What did you eat yesterday? Give me a list. Always a diary. Anything with food, always get a diary. That will always be your answer on any exam. Eating habits. Again, as I said, tell me what's going on there. Adolescents should sleep more, but they don't. They're too busy. They're too busy with their buddies, and they're too busy on the phones, and they're too busy trying to do good at school to get all of those scholarships, etc. It's just part of it. They should exercise. They don't as much. They should brush their teeth more, but sometimes they forget, especially boys. And I know my first one was a boy. Get in there and brush your teeth. We know that there's always media, I don't even know all the names of the apps on the phones anymore, but again, there's so much stuff that children can get into, even adolescents, even young kids if we're not careful about it. So sex education, making sure they get accurate information. And how do we do that? Can we give an adolescent without a parent information about contraceptives? And the answer is yes. We
If
can
they're
give
over
them,
16, right?
it's yes, written and oral information we can give, not our opinion. Okay? That was a HESI question a couple of years ago. It was, can we? Yes, you can. But again, it doesn't go into age. But I think it's about that age, if I had to guess, Brittany. If not, I would be asking before I'd said anything. Safety promotion. What's the one with the most injuries? Again, any age, motor vehicles. I mean, can you imagine? I remember kids getting on top of roofs of cars and then driving circles around parking lots trying to whip them off. And I'm from the country, so there was a lot of stuff like that going on. And the amount of injuries were crazy. So motor vehicles will be there. Firearms, because now they're big enough. They can play with daddy's gun. No, they can't. Sports injuries. This is the kids trying to get into some school and they're going out and they're pushing themselves like crazy and they get injured. This is just part of it. So Matt is 14. what happens in early adolescence, that growth spurt, right? He's always eating, although his weight is appropriate for his height. The best explanation for this is what? He just gained 20 to 25% of his body, height and weight. He's increasing his body mass. It's normal, absolutely normal. In fact, we want to see him gaining weight then because he's gaining that much height and weight. He needs to fill up that bones, right? So let's do our cahoots. I know we're going to be done with today. I think we just hit it right on good time, to tell you the truth. Any questions? Anybody? And this is actually a smaller cahoots.
I have a question. It's a little bit off topic. It was more
Okay.
towards the ADHD. I was reading about Tourette's associating together with ADHD. What
Well,
are your
well, Tourette's is when they have those outbursts.
yeah.
It is like a hyperactive vocal where they keep coming out with it. Tourette's is like an ADHD. It's a different type, but it is a format of it. They don't control themselves, just like your a kid with just normal ADHD. They can't control themselves. They don't know they're not finishing things. They don't know to sit down. They just don't know how. Same thing with Tourette's. They're coming out with these things, and again, it's counseling, it's medication, it's all of those things that help. But thank you, Claudia. That was a good
Thank you.
comment.
I read it yesterday and it got me thinking about like how do they go together? How do they relate to each other?
Does that make sense now?
Yeah, yeah. So
Okay, good.
I know that it's treated with like you said, it could be. I read that it you should treat ADHD and it helps with the Tourette syndromes or something like that. Yeah.
It calms them down. It really does.
Mm-hmm.
It calms them down and they can control themselves. And they won't have as big as outbursts. So whoever's the Packer fan, it's been my favorite football team since I was knee high to a grasshopper. So I'm glad to see that. They just messed up the game the other day. Here we go. Adolescents. There's not that many of these, so we'll be done, about 20 minutes. 16. Erickson's identity versus role confusion. What is that? Who is that? Who wants to know their identity? And that's the way you need to look at these questions and think. Who needs to know their identity? Who am I? What am I going to be? And yes, that's your adolescent. School-age children don't have to worry about it yet. When is adolescents need to establish their own identity and to form values to live by is what? When? Form their own identity to form what they're going to live by, their role in the future. And it is stage 5, which is adolescence. It goes infants, toddlers, preschool, school age, adolescence, stage 5. And again, it's that role. Am I going to be a doctor, a lawyer, or Indian chief? What am I going to be when I grow up? In the identity versus role confusion stage, adolescence, what? So, identity versus role confusion is who am I and what am I going to be? What do I like? Do I want to be short hair, long hair? Do I want to color my hair? Do I want to lose weight? I mean, all of these identity. Who do I want to hang with? Do I like the sports group? Do I like the drama group? I mean, these are all things that are decisions that we actually make when we're adolescents. What age do you have to be to drive an ATV, all-terrain vehicle? What age? Minimum age. If I could tell you how many kids I see going down Chrome Avenue, which is right there by the Everglades, that big north to south road, and they're young. They're so young. It scares me. You have to be at least 16, according to the book. And again, it's because of everything that could happen. Since surviving a sexual assault, she startles easily, feels numb emotionally, and has flashbacks. Her symptoms resemble what? One of the things about children, and especially as nurses, many times we get them into the ER to be assessed. Remember, the child has an issue, but remember, what about that parent? What about that mother, father, brother, sister? Remember, they also are hurting for that child, okay? It's one of the things that we should not forget. That child is going through post-traumatic stress disorder and will need some sort of counseling. That child and the family need help. Many victims experience emotional and reactions from rape and sexual assault. Emotional and blank reactions. So it's that psychological. It's all about their thinking day to day. I can't imagine. Thank goodness it's never happened to me, but I've had a friend, and they always feel, they're afraid to go out at night or be alone or go certain places, and I'd have to go with them certain things, and it's a very scary thing, and it takes time and it takes patience. You never really get over it. Which of the following are false about HPV vaccine schedules? What is false? It's the 2 to 3 injections. On it, adolescents less than 15 only need 2. Okay, it's 6 months in between it, and sometimes we put a third one in there. Okay. At what age should a parent expect to have major conflicts over independence and control with their child? Remember, this is when the adolescent wants to do what they want to do when they want to do it, and the parents are having a trouble with it. I say the age reflects they've gone through that pre-adolescent growth spurt, they're tall, they're looking more adults, and now they want to act like an adult, and that's that 15 to 17 age. What Tanner stage marks the onset of puberty in most males? Remember, you have stages 1, which is your baby, right? That's the child body. And we know 5 is the adult body. So with that being said, what's the onset of puberty? It's when the scrotum gets large, and that is stage 2. Okay, very good. What marks the onset of puberty in girls? So what happens with puberty is that monarch, it's the breast buds that come out first. That's the most physical thing that you would see. What is the Tanner scale used for? What is that thing all about? And the reason why I put it in there so hard and heavy, I've seen it, the concept of it on the HESI. And when I see stuff like that, I'm going to give it to you in a couple different directions so that you can remember it, okay? Every single HESI, I go look at where were the most misses made. And with that, I find a concept. Now, I have no questions. I don't know what questions are on the HESI. I just know it's about Tanner. So that's why I hit it like this. And yes, it's all about puberty and sexual maturation. Major causes of death and injury in adolescence is what? Everything is motor vehicle. Highest injury, any age child, motor vehicle. Motor vehicle. True or false? Sex education for adolescents aims to provide information to adolescents about issues related to sex. Is that sex education? And remember, we can give it to them. Absolutely. It's, sex education is all about things related to sex. It could be anything. It could be all about holding hands. It could be about a cold sore. Anything it's related to. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? Again, get the parents out of the room, and I always like to start building up the rapport before I have to get there. When I say I like certain rock bands, or I say certain things, or I know of them because of my kids, they're like, oh, she's a pretty cool lady, and I'm like, I'm not here to hurt you. I'm just here to help. That's it. I'm not going to tell your mom anything. And they really come, and they're going to start telling me, la, 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 because I am that nurse that they feel they can ask the questions to. And if I can help prevent something in the future, I've done my job. True or false? Keeping a food diary is the first step of treatment for an obese child. Infant, toddler, preschool, school age, adolescent. Yes, 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 yes. When you have a problem with any concerns nutrition, whether they're skinny, fat, doesn't matter, it is always food diary will always be your answer. And last question, a multi. An adolescent has been brought to the ER with a drug overdose. What are initial questions you need to ask? Initial questions. You have an overdose. I've worked adult ER, I've worked pediatric ER, and I can't tell you how many drug overdoses and drunk children I've seen in my life. And the most important thing that we need to know is, what did you take? When did you take it? And how was it administered? We know IV is going to go away quicker than something orally. Okay, that's why we need to know that. The drugs, well, we don't want to know what it is. At this point, rehab is not a question. We have to treat the critical problem, which is the drug overdose. Number 3 is Megswag. Good job. Number 2, Madeline. Good job. Number 1, drum roll. Chris. Good job, Chris. And we have a Megan and overwhelmed. So this is my end of my class for today. Does anybody have any questions? Please make sure you look at your calendars. There's been a couple different changes in some of the reviews. I made sure it's on everybody's calendar when they're going to be done. Professor Pace Chismar put hers to Sunday, I believe, and another one's going to be on Friday. So please just look at your calendars because we had to do some changes. Mine is tomorrow, 3 o'clock, and it will be posted almost immediately. If you want to hear it before your professor puts it up, just go to Professor Bogart on the YouTube. Professor Bogart, Pediatric Nursing. And
Thanks,
it'll
Professor.
be there. It is open. Anybody has any questions, let me know. I'll be posting this on your announcement too. So everybody gets it tonight. Everybody gets it from me. You're going to get all my stuff.
And
So,
you'll
Thank
post
you.
thank you,
everybody
guys.
review, all the teacher reviews, correct? Okay,
Have a good night, Professor.
thanks.
You
Hey,
too. It's
Miss
been a
Bogart,
pleasure.
I do have a question for you.
Sure.